Okay, good morning, good afternoon, everybody. We wait 1 minute and we start this second episode of CHERRIES Webinar Series. I think you can see my screen, right? Just a technical check. Good, let's start then. So good morning, good afternoon, everybody. My name is Chiara Davalli, and I'm project manager at UBN, European Business Innovation Center Network, one of the partners of CHERRIES project. And today I'm very happy to host this second episode of CHERRIES Webinar Series. As you might know, we have launched this series of 4 webinars to explore together with experts, academic experts and practitioners, the responsible healthcare ecosystems in Europe. So to share some knowledge and know-how on this sector and how to shape inclusive and sustainable and responsible innovation policies in this field. So last week we started with a conversation on the role of need in open and user-led innovation approaches in the healthcare sector. And today we go deeper in the discussion on how RRI practices can influence the healthcare sector, can play a role in this sector. And this conversation will see protagonists Rosina Malagrida from IRSI Barcelona and Barbara Kislinger from ZSI, and she will be talking mainly about the Caribous Project she's coordinating. Again, as I was telling you before, this is the second of 4, so you can, of course, register already also for the upcoming sessions. Couple of practical information. So we are recording this webinar, and the recordings together with the presentations will be made available on our website. For example, you can already find in the news area of the CHERRIES website the summary and the materials from the previous episodes. And then the second information, very important, is that you can interact with us and maybe with the speakers by writing your comments, questions and suggestions in the chat box you have available on the platform. So feel free to throw your questions and comments there at any time. I'll be monitoring this area, and if possible, I will be already proposing some questions at the end of each presentation. Otherwise, we'll take them for the final discussion. This webinar series is aimed at contributing to the overall architecture of and the goal of the project. That is in a way trying to contribute to the discussion going on how the regional innovation policies can be more inclusive, responsible, especially as far as the healthcare sector is concerned. You can check what the project is about in more details, of course, on our website, but just wanted to mention you that these conversations with these experts are for us also, let's say, for the program itself, very important to nurture a bit what will be going to pilot and test on the ground with healthcare practitioners, policymakers in the 3 pilot regions that we are going to work with: Murcia, Örebro, and Cyprus. As I was telling you, today we are going to hear from 2 speakers that I'm very happy that accepted our invitation. So we'll start with Rosina Malagrida, that is the head of the Living Lab for Health at IRSI-CAIXA, and she's also the coordinator of the Barcelona La CAIXA Living Lab. And she's an expert in facilitating the multi-stakeholders innovation ecosystems. That is at the core of what we want to discuss with you today. And then we'll hear from Barbara, who's the coordinator of the Caribous.org EU-funded project, and she's working at ZSI, and their work is mainly on citizen science and citizen innovation, and how the technology and social innovation get along and come together. And I think the Caribous Project is an interesting case for this. So when debriefing a bit with the speakers, a question came out and was, is the responsible research innovation framework developed enough to embrace such a complex ecosystem like the one of healthcare? I think this is a good starting point for the conversation. And so I give the floor to Rosina to tell us her experience and give us her speech. So Rosina, if you can share your screen.
Sure. Hello, everybody. Very glad to be here with all of you today. Thank you for the invitation. I'm going to put the presentation mode of my PowerPoint. Let me change one small thing. I think now you can see the slides, right?
Perfect.
So
yeah,
if that's okay, I'm going to start. As Chiara was mentioning, I'm going to talk about managing complexity and how to manage complexity. So by being inspired by RRI, but also by including something else, what is called system thinking. And the title of my presentation is this one you are seeing on the screen now. And it also says, or I have also put the question of whether is RRI enough for what we want to achieve. Just to start with a very brief introduction, we all know here that our model of civilization is mainly defined by research and innovation. And we all know that our model of civilization is not sustainable. And if we look at our model of healthcare, we could say the same thing, that at the moment it is not sustainable. And we are seeing now with the crisis we are living today, how this is the issue, the main issue we are facing in our countries, together with many other issues. And what we see is that most, or not most, but a lot of the problems we are trying to tackle, sometimes they are not complicated only, but they are also complex. And what do we mean by a complex problem? We mean a problem that normally can be tackled with different solutions, and a problem that when we ask to different disciplines or different stakeholders, the definition of the problem can be seen differently by different actors. Therefore, for its resolution, we know that we need to involve different disciplines and different stakeholders, and that we will need to address it not only at local level, but also at global level. And sometimes these complex problems have complexity at the scientific and technical level, and sometimes even also between these levels and also the social level, right? So also the interaction with different stakeholders and with citizens at large. So this makes the resolution of this sort of problems very complex. We already faced this situation a long time ago, maybe more than 10 years ago in Europe and at global level, and we realized that we needed to change the way we were solving our problems. And luckily, RRI came to all of us. Before RRI, this is the system of research and innovation, and these are the stakeholders that had traditionally been left outside, so civil society, policymakers, and the education community as a summary. And inside the system, we had researchers and innovators. And for decades and decades, we thought that technology transfer and science communication and marketing might solve the problem, and we could solve our impact problem among other problems that we are facing in the relationship between science and society. But luckily, then RRI came into the scene and they told us, no, you have to put this arrow the other way around. We need to engage these stakeholders in the system in order to be able to solve our problems. After that, a lot of initiatives came up after RRI, and we have seen, like in these maps of the wall in the below part of this slide, that there are many thousands and thousands of initiatives all around the globe, with even sometimes intermediary structures being created to achieve this aim. And for example, we have Fab Labs, we have maker spaces, we have science shops, living labs, research groups doing citizen science, and so on and so on. We also have a wide variety of approaches to conduct this open science and open innovation, or RRI approaches, right? Like transdisciplinary research, user engagement, patient and public involvement. This is a strong movement in the UK, patient experience. So we have lots of different namings for different approaches to how to address this lack of social impact that we are facing, and that we would like to improve by changing the way we conduct our research and innovation. But we believe that we are still, as it was said in the scientific literature a while ago, we are still in a deficit model, even though we are trying to change the paradigm towards RRI. As the person who defined RRI first, René von Schomburg, said in a conference we invited him 2 years ago here in Barcelona, he already said that we have efficacy at individual level because our researchers are effective. They are really managing to publish and to fulfill the evaluation criteria they are evaluated against. But we are facing what he called inefficacy at systemic level. How can we explain that a little bit better? Well, I have put this slide, which of course it's for dissemination purposes, because we all know that the process is not so linear. But if we put in a linear manner, we could say that normally we have a challenge. From this challenge, we have an idea. And from the idea, we do open science, then we do open innovation, and we find a solution. And we expect that this solution will be able to scale up and impact in the system. For example, in this slide, I have put an example with the food system, right? With the new paradigm we are with RRI or with open science and open innovation, what we have been facing is that we needed to involve already at this stage here stakeholders from the system in order to make sure that the research and innovation would respond to the needs and expectations of these stakeholders. So we were somehow focusing at project level by involving these stakeholders in this process. In some initiatives, we even involve them here when setting the research agenda with, for example, methodologies for participatory research agenda setting. However, what we are facing still is that even if we apply RRI in this manner I described, we sometimes don't get the impact still that we would like. And that's because we face this wall that I draw here with these little balls in green. And what is this ball with these little balls in green? These are the elements of the system. I don't know if you've heard about Hills. He is from the Netherlands and he has published a lot about transitions. And he explains to us that if we are carrying a research and innovation project that we can represent with one of these small arrows, and then when this research line is conducted by a lot of research groups, maybe it's one of these arrows here. If we want this arrow to really impact the system, to really go through here and impact and change the landscape that we have currently in our community or in our country or at international level, we need to overcome all these obstacles that this arrow here is facing with all these arrows here, which means that in the system there are many other aspects that also have impact in the research and innovation that we are carrying out. So we need to visualize the future vision that we want this system to look like and take it into account when we design our research and innovation in order to make sure that it will have the impact we want. And of course, this cannot be done at project level on our own from our project, but we need ecosystems because here there is a lot of complexity. There are many different regimes or aspects in our system that are having an impact in our practices and hindering our impact. We have in our project Fit for Food, which is a current project we are involved now, we have drawn that picture by Hills in a more simple way with this picture here, which shows us that in order to decide which research and innovation we need to do to really have an impact, we need to take into account different elements of these transitions. And these are the elements we need to take into account. So trends, for example, that are there, some of them are obstacles to what we want to do. Some of them may help us to have more impact. We need to take into account showcases and also other breakthroughs that are going on in the system and maybe the one we are involved in as well. So basically what we can see with these approaches, taking into account what could be the theory of transitions, is that sometimes we may be trying to reach an aim and have an impact by only seeing one part of the iceberg, while we are still having other problems and other aspects that we may not be taking into account. Sometimes perhaps the problem is that we are moving from problem to solution with a linear system, with a linear thinking, instead of having a more systemic thinking, and therefore taking better into account the root causes, the interconnections of the problems, and also these different areas of the system that we could see in the picture by Hills before. And these are the elements that are this wall that may be hindering our impact. And what are these elements? They can be different challenges within what we are trying to achieve. For example, if we are working for improving healthy and sustainable diets, we have different challenges within this big challenge. So we need to take into account all the different challenges, also different areas of the system. Here we have a picture with different areas of the system that need to be taken into account. Also different phases. Normally, for example, in the Food 2030 strategy, we were seeing that the system was being represented by the phases of the value chain. In a healthcare project for an illness, we could put the phases that a patient goes through during all the illness, for example. But here we realize that it's not only to look at it through the phases, but also through the areas, and this can help us to better address complexity. Also, we need to take into account geographical, organization levels, different academic disciplines, a wider variety of stakeholders than we might expect, because these areas of the system may inspire us to involve people that we didn't expect before, perhaps. Also different sorts of solutions, and then elements, as I said before, elements that can give us ideas of how change is already happening, what are the key factors that lead to success in this change, and therefore how can we take those into account to have to assure that our practices will impact with change. And the question is, of course, there are loads of green balls in these drawings. They are easy to put on a slide, but how can we manage this complexity with different stakeholders in an ecosystem? There are different approaches in the scientific literature that are starting to help us to understand complexity, so we can bring those to these ecosystems. But sometimes we face them, they are perhaps too simple or perhaps too complicated. So there is here a challenge for every facilitator of ecosystem to find or develop its own map to make sure that we can help our ecosystem to learn about complexity and to tackle it. And we believe that the only way to do it is by building a permanent community of practice, because complexity is so huge sometimes that we cannot address it with a single workshop or with a cycle of workshops. So what we do, we set up communities of practice, and we do dynamic and iterative processes where we face mutual learning, strategic reflections, at different levels, and we focus on systemic change. And that means that we address change at organizational level, but also at collective level, and we promote systemic innovation. Here you can see pictures of pre-COVID and post-COVID workshops. And in these workshops, what we do is we first develop knowledge together with our community on the complexity, what we call systemic knowledge. So we map the present. For example, why is it so difficult? We try to answer, why is it so difficult to solve the challenge? What are the key factors and dynamics that are hindering the change at the moment? Then the second part of our community of practice, very important, is to develop also knowledge around the target. So the future vision. So we design together a shared vision. So to respond to the question, what do we want to achieve as a collective? And finally, we develop knowledge with what we call transformation knowledge. And in this transformation knowledge, we use this theory of transitions that I mentioned before to develop together with the community knowledge about where is it necessary to promote change, where is it more urgent to promote change, and how is change happening already. And then we develop the roadmap for change in our ecosystem. What do we want to achieve with this sort of projects that we are running? So for example, in a project we are now on promotion of healthy and sustainable diets, what we want to achieve is something like in this slide. So instead of addressing one part of the problem, the part of the iceberg that we see, like for example, with a project that we may have a nutritional intervention by pediatrics, for example, what we try to do is to bring to them all the ecosystem with different initiatives like feeding centers, like communication channels, and also research and innovation going on in this area, and to explore all together how they can learn from each other, improve what they are doing, make their approaches more systemic by better taking into account factors that they may not be taking into account in each of these interventions, but also by better responding to each other's needs and addressing the agenda together. So aligning the vision and aligning the roadmap to achieve this mission in order to help each of them to have a better impact. Of course, we are inspiring by all these movements in the European Commission and also at the global level, like the ones we are seeing here: mission-oriented research, open innovation and open science, RRI, transdisciplinary research is also very inspiring, and of course, system thinking, very important. This document here of the UN, we also are very aligned with this approach that the UN is suggesting to attain the Sustainable Development Goals, where they mention that we need to create these ecosystems, these platforms that help to promote change in the research and innovation system at the same time with change in the system that we are trying to have impact. And finally, there is also another initiative recently by the European Commission, which are called the partnerships, which are still quite new, but they seem also to be very aligned with all these policies, and they are aimed at achieving these ecosystems, but also with international and global governance. So to finish my presentation, as a conclusion, I would like to emphasize that in health, because the talk today is on health, we are focusing a lot on mapping our systems, our health systems, like in this picture here, but perhaps we are not focusing so much in mapping the complexity that the people behind these drawings are facing to achieve the knowledge they want to achieve. And as Matsukato says in one of her documents on mission-oriented research, she says that we need to include new conversations between fundamental research, applied research, and cutting-edge innovation. And the question is, how can we address all that? And as I have summarized in my presentation, collaboration at ecosystem level is very important. And I like this metaphor in this picture. As you know, this is the Millennium Bridge in London by Norman Foster. And as you know, in the year 2000, when he opened, he couldn't anticipate the impact of all these people crossing the bridge, that they entered in resonance and they made the bridge move in a manner that he couldn't anticipate before, which showed the power of people walking at the same speed. And this is the power of ecosystems aligned with a shared vision and a shared roadmap, but not only aligned, but drawn, attending the complexity of the system and looking for more systemic solutions. And that's it from my side. Thank you very much.
Thank you, Rosina. Thanks a lot for your inputs about how to manage or at least consider complexity in the ecosystems, healthcare ecosystem, or you were presenting the food one. Thanks a lot. I don't see questions for the moment on the chat. I let people continue listening to us, and please share your questions. So I would now move to the second presentation with Barbara, and then we open the Q&A.
Yes, thank you very much, Chiara, and thank you also, Rosina, for this very inspiring talk. Actually, I find also a lot of what you were saying resonates in our project. A lot of complexity is there and a lot of elements of the system where we're also finding our boundaries. My talk will, however, be much more practical, I would think, because I'm going right into the details of how to do open healthcare in a new way, making use of maker spaces that were also mentioned in your talk and other skills. So the Caribous Project, how can I move on? Yes, Caribous is actually, I mean, it started as a European funded project, which it still is until the end of this year, where we have the official name made for you, and it is labeled as an innovation action there. But we see each other now much more as a community of people and organizations who are committed to co-designing and making of open personal healthcare for everyone. And we started with this idea already some years ago, where we already saw initiatives where people said, I don't want to wait anymore to get something from the social services that doesn't work for me, or it's not accessible, it's not personalized. And there are new methods and there are new ways of fabrication that I can make use of, and I will make my own thing. This was where we were inspired. But let me tell you a little bit more of a story how something like this works. So this is, for example, Lupo, and Lupo, as you can probably already guess here from the image, Lupo is blind, and he has a problem with his cane that he's using when he's walking in the streets of Milano. So he came together somehow with people working in a makerspace, and together they were exploring how Lupo's cane could be improved. So he was sitting there with them in the lab. They were doing different kinds of analysis. He was talking about the story, what was not working for him. And then they were doing prototyping together, testing out various types of cane tips. And in this co-design process, together with Lupo in the makerspace, they came up with Lupo's cane tip. And Lupo's cane tip is now really working for him in these in the streets where, you know, usually he got stuck or he couldn't really identify the barriers between a rather small elevation of the street and things like that. So, but this Lupo's cane tip isn't only Lupo's cane tip, it is also shared on our platform and accessible for everyone to be reproduced and modified. So that's the main concept, so to say, between Caribous. We also have tried a definition for a Caribou. So Caribous is everything is like the community, and a Caribou is a solution that aims to improve the quality of life for people with unmet needs, or they face some kind of physical limitations. What is very important for us is working towards openness, so that the design, which is usually co-designed, it is replicable, accessible, adjustable, and shared online. You don't do it for yourself, but you also make it available for others. And we don't really focus on the product alone, on the Caribou, but also on the process. So we see it as a very horizontal and collaborative approach towards health and care. And just you know, since we're already in the mood of these examples, to give you a few more. This is one that came out of a recent training activities that our Berlin partners were organizing. They have already a series of training events, which they call academies. And this was an academy mostly focusing on issues that wheelchair users are facing with in their daily life. And for example, this team came up with a slide and shop. So it's an add-on to a wheelchair that you can accommodate, you know, the shopping basket or the shopping bag, and it's makes life easier for wheelchair users when they go into supermarket or when they do their daily shopping. Another completely different example is the Stoma Noir, which is also in the, I think, in the second or third version of it, which a patient co-developed in a makerspace, saying that she has problems with her stoma bag, with the capture, actually, with the closing of the stoma bag, because still, like, bad odor comes out, and then she feels like socially isolated, doesn't want to go anywhere because it makes her feel uncomfortable. And so together, also in a co-design process, they came up with a new design on how to make this cap better isolate. And now this is shared again, for example, on our platform, and people can also reuse and remake this kind of design. Or a nail cutter for one-handed persons was shared by a person on our platform. A completely other example again is this are these glasses which have the supply for oxygen, for people who would need oxygen. And apart from these, and we have now, and I have the figure again, I think somewhere almost 200, I think, of these kind of shared co-designs for healthcare solutions on our platform. But we are also documenting the methods for co-design and how to best document how you make it, because this is something that is also very time consuming, and that sometimes keeps people away from, you know, from really documenting it properly, so that others can also then remake it. We're working here on good guidelines and make it as easy as possible, the so to say, the documentation and the sharing process. And so while we were working on all of this for almost 2 years, COVID came along. And then we said, okay, so open healthcare, personalized healthcare being done in maker spaces, you know, moving away from this dependency on centralized mass production to local production, personalized production as need comes along. I mean, the maker community was really ready to go into supporting wherever they could, and inventing also new devices to support fighting the corona crisis. I mean, the very classical example is, of course, the face shield, and we have now shared variety of different versions of the face shield on our platform. But people were also creative, and they came up also with other kind of solutions, like a door opener where you don't have to touch the door, for example, or other devices that go more into medical supply for machines, like different valves and things like that. So I was really amazed at how fast the whole maker community was also responding to the COVID crisis. And we offered our platform, of course, for the sharing. And we didn't only share resources, but we have a special section for COVID-19 on the platform, where we share stories, like our partners in Brazil. They were also seeing the need straight away for their local hospitals to provide them with these protective gears. And so they were bringing together various maker spaces where we're working together and producing up to 140 or 200 face shields a day, equipping especially the hospitals that were in clear need for these kind of devices. And they were also then sharing they adapted, for example, one of the famous designs for a face shield to the Brazilian local case, made with different material. They called it the tropical face shield. So, and then they shared again their design. Or we have other stories also from Iraq or from other countries, maker spaces in the global south also, who were all sharing their stories and resources. We have, as we said, resources on how to make PPEs, for example. These are examples here of very specific COVID-19 related resources, like a handbook we had, and I will come back to that a bit more in later on. We had a lot of issues, of course, about legal aspects, legal and ethical aspects. And there where we saw again, you know, what we heard before from Rosina, the elements of the system that add to a lot of complexity and often barriers. So people were also consulting us on these aspects. We have a special legal team advising us on legal aspects. And of course, the sharing of the projects themselves. So we have four specifically for Corona. Now at the moment 38 projects which are documented and ready to be also replicated, and they are all accessible on our platform. But how would such a documentation, for example, look like? Just to give you a little bit of an also very, said I'm at a very practical level here, very practical insight. So if you move to if you zoom in the platform and you zoom into the one of the Caribous, one of these healthcare devices, you would get, depending on how good the documentation is, you would get the summary, you would get images, you would get detailed instruction on how to do it, even the files that you have to send to the 3D printer, an assembly guide, contact details like who did it, a license information. For most of the Caribous, we would also have the bill of materials, so you would know exactly what to buy, what kind of material you would need. And this goes for all the Caribous, not only for the COVID-19 specific Caribous, of course. So again, coming back to the platform, we have around 180 of these kind of projects documented and shared at the moment on our platform, and as I said, 38 specific related to COVID-19. And I have to say, I was surprised myself with all the great solutions that people come up with, and so many problems that haven't been tackled so far. What can be done there? It's really amazing. Also the very creative designs that they come up in our training activities, for example. Yeah, so it's worth checking it out, just to say. And coming back a little bit more to the RRI focus here, we also defined with actually working on what was already coming from the community, from the global community, because we have a very global focus actually in our project. We have the Global Innovation Gathering as a partner, who is kind of regrouping lots of people from the Global South and from maker-oriented people and spaces all over the globe. And so building on already on their principles, we made our responsible making principles, which you know, have of course a lot of RRI elements in them. So that, for example, we make things that make sense, and you know, you don't just create for the art of creating, but really something that answers to real person's problems. So in our trainings, typically people who would really have a personal need would go and attend and would be kind of the case givers and also taking ownership together with the people creating. So again, maybe that brings me to the co-designing with others. So you would also share your experiences. You would empower people, so it's important that you don't only do it, but you also show others how it can be done and how people can take more ownership, and that you share. I mentioned that a lot already before, and that you share it openly so that others can then also replicate the solutions, and you choose the most appropriate license for your projects. But, and especially, you know, in the healthcare area, that you also acknowledge when, you know, when there you have a limitation, and that you work together with people from the healthcare sector, for example, because quality and safety standards are of course very important. And we have seen that in cases. So for example, I don't know if some of you might have read about this at the very beginning actually of the corona crisis, that when the maker started becoming active, there was this famous case in Italy where a maker was producing a valve for a life-saving treatment, and the company who originally had produced the valve didn't want to give away the design, so the maker had to do a reverse engineering to produce the valve. And it was not clear whether the company didn't want to share it because of quality issues or because of business interests. So there are a lot of ethical questions coming in here. We, as I said before, also we do have legal and ethical guidelines. We do have a partner who is especially dedicated to giving us legal advice. We also have a white paper out on this, and it covers aspects as privacy and data protection, IPR issues, liabilities, who is liable when I share an open source platform healthcare product on the platform, other ethical considerations, as we just heard from the case before, and of course this, in terms of quality, medical device regulations. So there's a lot on the plate also in terms of complexity, and a lot of elements in the system where we that is partly of course also hindering or affecting the considered transformative process that we want to initiate, or that has already been initiated with projects such as Caribous. And just to mention also before finishing is that we of course have other activities. So this is a little bit of promotion, what is still going on, because we are having now a moving exhibition, and we will have a call out, so anybody who's interested can also do the moving exhibition. In terms again of RRI and sustainability, we usually don't send things around for the exhibition, but we send instructions on how to make it locally, how to produce the, so to say, the exhibition locally as far as we can. We do have a global outreach with our social media channels, and anybody who would like to join there is also welcome. We do have training activities. We do organize summer schools and the academy that I mentioned before. So there is quite a lot going on. We already have a plan on how to continue after the funding period with the sustainability model, where one of the partners is going to establish also a local office. So you will hear from Caribous still further, and we are moving towards that transformative innovation wave in healthcare sector. We want to, keep going this way. When I say we, this is the core team of the Caribous project actually. So I work at the Center for Social Innovation here in Vienna in Austria. We have the Open Dot and Together to Go from Italy, who already teamed up before in making Caribous, as one is a makerspace and the other one is a therapeutical institution or association. And we have other makerspaces from Germany. We have the Karl Leuven, as I said, for legal advice, and WAG also from the Netherlands is another makerspace who works a lot in the healthcare sector and also teamed up with hospitals in this aspect. And this already brings me to the end, and I would also be happy to either take questions directly or enter into a more general discussion on what we have been discussing so far. Thank you very much.
Great. Thank you very much, Barbara, for your presentation and for sharing these insights about Caribous. I think very interesting program and impactful. It's nice to see these EC funded projects that have then these type of outcomes. So let's open the discussion. Let me take back the role moderator so you can see my screen. We received a question from the audience from Claudia Colonnello, who's also part of the CHERRIES team, and she says, indeed, thanks for framing innovation in the complexity and the complex theory of change. Can you say something about the level of the organizational, institutional change within research innovation healthcare system on the basis of your experiences as part of the ecosystem? So maybe Rosina, if you want to start.
Yes, yes, we are in our living lab at the moment. We are focusing mainly on complex problems, and we know that complex problems are those that will not be solved by a single project or by having loads of organizations running projects. And one example is the one I gave before, the promotion of healthy and sustainable diets, where we can see that no country in the world has managed to reverse the tendency towards increasing obesity, for example. So we know that there are loads of efforts to promote healthy and sustainable diets in the world, but there is no country that has managed to have the impact that we would like to see. And we are all very worried about COVID now, of course, and it's a very serious problems that we are facing, but obesity is also a very serious problem. So we know that if we, as in the past we used to help one single organization, for example, one research group or one consortium working in a research project with different organizations, we tried to help them to change the way they were doing their research. And now what we are facing is that this is still compartmentalized, because this research has to be changed at the same time as we imply changes in the system. And this means changes in other organizations that are not within the research and innovation system. So as you say, an institution like, for example, the City Council, right? So we believe that for the true systemic change that may help us to improve, for example, the way we promote healthy and sustainable diets, we need to do it at different levels. And we need to do it at organization level and also at collective level. And so in our workshop, we pay special attention to these both levels. And we reflect on the changes that each organization will need to do, and also the collaboration that we will need to establish or change from what we have now. And of course, with these collective efforts, what we also need to change at individual level within the organizations. Because, for example, if we have an agency of public health running nutritional interventions, and they realize that they should better work hand in hand with communication channels and with researchers, they will need to establish these collaborative spaces where they co-decide which new knowledge is required, and they co-produce it even. They reflect on how to make it a bit more complex, not only nutritional messages, for example, but how these messages can also take into account other barriers that are in the system, like time or any other ones that consumers may have to really make the change. And so this new, more systemic approach will require changes at different levels. I don't know if I answered the questions.
I think so. And yeah, Barbara, do you want to add something?
Yeah, I mean, also for us, at least in our experience, especially for the Caribous Project, it wasn't so much the organizational change or institutional change. We already see that happen at certain places, even with hospitals, you know, getting their fab labs or small spaces where they can on demand produce locally. But for us, for this moving away from this centralized mass production to more this local production also of healthcare, we found a lot of the complexity for us and these barrier elements of the system that we need to still change is probably more in the regulatory frameworks, in the legal aspects, in the business models and so on. So we saw it more there at the moment, you know, from what we were experiencing. And if I may already answer the second question, so the Caribous platform, Of course, it would be good if you already knew any local makerspace or so where you could also go to. It depends a bit, of course, on the careable that you find and how complex it would be to make and what kind of support you need. But we're still working on this. We are also working on a community map where we map spaces that specifically dedicated to making healthcare products. So there is, I don't know if you're aware of it, there is a big Fab Lab community, Fab.io, and there in this one there's also now an initiative dedicated specifically to healthcare, and they also started to map those Fab Labs and those maker spaces that are specifically working on healthcare solutions. And we will also have a community map on, and we're working together there with them, which we will hopefully then put on our website. But generally, yes, it's good to know, what kinds of tool you would use, how complex the careable is, and then hopefully you will have somebody in your vicinity, a kind of a space where you could turn to.
I think that just a comment on my side, you both mentioned several times the importance of the mapping exercise, knowing who are the players, and not only who are. I liked very much a slide picture presented by Rosina before, who was showing a classical, let's say, a standard mapping with the different players listed there, but then next to it, the different arrows going around showing the complexity behind that list of actors involved or playing a role in the ecosystem we are addressing. I think that probably one of the elements that is going to differentiate a lot the different players is also the speed, how fast are the different players are moving in that ecosystem. Because if I think about a maker, or the examples that Barbara was presenting, it is also a way to probably have some faster, ready to use solutions than indeed involving institutions that have different speeds, that have to go through different procedures internally and so on. So I think this is definitely part of the complexity we are discussing today. And maybe a question for you both, again, from your experience, is also the role of intermediaries. So how the intermediaries should, do you think, play a role in order to be more effective in managing, or at least trying to kickstart this conversation about the necessity of involving more players in the ecosystem, and then how? Who takes this first? Rosina.
Yeah, I think it was very interesting that you invited Barbara and me together, because the approaches that we are experimenting are quite different. And I think they are very much complementary to each other. So responding to your question on the fast ones and the slower ones, and so, or also the question here on the chat about the patents, I believe that we will need in cities to have ecosystems or communities of practice where every single stakeholder, the fast one and the slow one, they can all attend together and reflect and learn from each other on the complexity of what's going on. And then out of this reflection and this learning, many ideas will come up. Some of these ideas will be patented. Some other ones will not be patented, and will be free, like Barbara do, open access and so on, right? But some of them will be fast, some of them will be slow, long term, short term. But what is important, I think, is that there are these spaces where we learn about the complexity before we move from problem to solution. Because I believe that in some occasions, if the problem is just complicated, it's great to move from problem to solution. Then it's great to go directly to the Fab Lab. But sometimes, perhaps if you can go to this community of practice before and assure that that's the technology you need to develop, and that will be needed, because as you had put in the summary of this webinar, sometimes we develop technology, but then we don't know why the impact is not there, right? So analyzing better the problem may help us to realize that perhaps the solution we were thinking is not the most appropriate, and there may be another factor behind in the root causes of the problem that may be better tackling, or perhaps both. I don't know. So this reflection, I think, is missing sometimes, and is really necessary, and maybe the answer to why some problems are becoming persistent. I don't know, Barbara, if you agree.
Yeah. And just as you say, you know, that I mean, we had approached the thing from very different angles also, as you were saying. And still, I mean, I think, of course, for us at the very micro level, when you have a specific health problem, we can address that, you know, in our co-design sessions with, for example, mostly, you know, with the co-design, and then you have something else. But of course, I'm saying, you know, if you want to scale it, of course, we also see we come into this complex systems of what you're saying, and there it's also not easy, of course, to implement any such innovation, and there are a lot of other players come in as well also for us. So that's clear. Just coming back also to a question about the patents. I mean, we are and our community is quite involved in, you know, in the open source hardware community, and promoting open source hardware as a different model, as I said, and promoting more local small scale production, sharing designs. But of course, we are also then faced with coming up with different kinds of business models. So that's where we're working a lot on now, or we reflect a lot on. It's of course clear we want to share the design should be open, but still there should be, of course, a way for people also to make a living. And you know, it doesn't mean that there couldn't be other types of business models where to then to make a living on whatever you produce there, but it doesn't have to be necessarily by you know, by protecting the original design that could help many other people as well. So patents isn't really I think the most preferable way in that sense for the open hardware community. But we are, of course, as I said, looking into different types of alternative business models.
Great. Okay, thank you both. I would take the last question to close our conversation. So I mean, I would share with you and ask you to comment upon the last question. If we want to take a more systemic perspective to healthcare innovation, where should we start? What are the most important blocking mechanisms you can think of? So I think it's a challenging question, but an interesting one.
It's very, very challenging, and I think we could run a workshop to answer this question. But just brainstorming loudly now, I would say that one of the most important blocking mechanisms now, one is having the know-how, and that means that we need to do research on how to do it, and we need training as well. And there are already some initiatives, but there is a lot to learn. So we are all experimenting. So know-how is one of the blockings. And I think another important one, of course, are creating intermediary structures. And as you were mentioning, Chiara, the need for intermediaries that facilitate this to happen. So there is a need for investment on that. And last but not least, would be that we also need to put in place what was I going to say? So it's the structures, the knowledge, the training. Oh yes, and the evaluation. I think one of the important blocking points here is how we evaluate research and innovation now. And I think one of the big challenges, and there are, for example, the Leiden University, who is one of the speakers in this series of webinars, they are working on that as well, on how to embed the evaluation in these communities of practice or in these ecosystems, so that the different stakeholders that participate at the same time are evaluating what's happening. So they are learning, evaluating, and doing. And I think this is a nice vision of the future for these ecosystems.
Thank you. Barbara?
I would just like to thank you, Rosina. This is very interesting thoughts, because we are actually also at the moment experimenting in this, what we call co-evaluation. So as you say, you know, that the stakeholders themselves are also evaluating, because it's a complete, at least it should feel completely different if you're the one, you know, from top down just watching and doing the evaluation and then saying, no, this didn't go wrong or right, but it's the people themselves, all the stakeholders that are involved. But I think there is still a lot to do to bring this across, and we're at the moment, you know, we are seeing barriers of this already in very small scale, in small projects. We're trying to implement this, and then I'm just thinking about, you know, changing or causing systemic change. I think this needs still a lot of also changes of attitudes, and, you know, rethinking certain power relationship and structures, and it's a it's a very complicated task, but we're super interested also in following up on that, and as I said, experimenting at the moment in rather small change. I mean, I feel like in the project level we are already at the very micro level, you know, still. So yeah, exchange
Great.
also from different perspectives.
Great. So thank you both. Thank you very much for your inputs for today's conversation. I think that the next sessions of our webinar series are going to, you know, maybe help us doing some steps further in trying to understand how to manage this complexity, how to understand first and then manage it, especially in the healthcare sector. So next week we'll be speaking about the adoption of healthcare solutions and so the role of procurement in healthcare innovation, especially in this framework of responsible research innovation. So how to embed also these co-creation, responsible, sustainable approaches also into the procurement procedures. And the last episode will be about regional innovation ecosystems for healthcare. And I think this last conversation is going to be very interesting, especially to, I was writing down some questions that I most probably posed to the speakers of this fourth webinar, because indeed regional smart specialization strategies, for example, could be a very good start, in my opinion, good starting point for the management of this complexity we were discussing today. It's my point of view, but it is nurtured by the experience I'm maturing with the CHERRIES program, the CHERRIES project that is exactly about this, how to shape regional innovation policies that can support this responsible approach to innovation in healthcare. So stay with us, follow us, not only the webinar series, but the project as a whole, because it's all about this what we were discussing today as well with our speakers. So I would thank you once more, Rosina and Barbara. It was very nice to be in conversation with you today. As mentioned at the beginning, we'll be sharing your presentations with the audience and then also with the wider public on our website. And yes, so stay in touch, and why not to organize maybe a workshop or another maybe session in the coming months to discuss some of the aspects we touch upon today. I don't know if you want to say something to close the session. Otherwise, Barbara, Rosina.
Just thank you very much for the invitation. It was very nice also talking to you, and I don't know if we will still get more reactions from this, so inviting everybody to watch the webinar, and yes, let's keep in touch.
Yeah, I would also like to say thank you very much, and to say that it's a pleasure to be living this moment of history, in the history of these intermediary structures, and where there's a lot of uncertainty, but at the same time, a lot of inspiration from interesting projects like the Barbara's project today that I hadn't heard before, and also your project Cherries and many others. So thanks a lot for sharing, and we will keep in touch through your webinars in the future. Thank you.
Great. Thank you. Thank you both. And buon appetito for those that are going to have their lunch now. Bye.
Thank you. Bye-bye.
Bye.
Bye. Okay.